Welcome back to Cancer Buzz, the podcast of the Association of Community Cancer Centers. I'm your host, Summer Johnson. On today's mini-episode, Cancer Care's road to recovery from a global pandemic. COVID's impact on delayed diagnoses and treatment is top of mind for those in cancer care. Today's guest published a study on the topic titled The Impact of COVID-19 on Cancer Care: How the Pandemic is Delaying Cancer Diagnosis and Treatment for American Seniors. Dr. Debra Patt is the Executive Vice President at Texas Oncology.
Community Oncology Alliance and Avalier Health work together in a collaboration to look at the 5% of the beneficiary claims. We looked at about 6.2 million Medicare beneficiaries to understand how they were getting screened and treated for cancer in 2020 in comparison to 2019. We thought that that was the best estimate of how to look at the impact of the pandemic on American seniors. And what we characterized, which was shown elsewhere in other data systems, was that there was a substantial decrease in cancer screenings, obviously as follows new cancer diagnoses, which says that patients just weren't having their cancers identified and treated, which was a challenge. So I think back to your question that using data systems like claims databases, like the Medicare claims data, commercial claims systems, the Medicaid claims systems, and how Americans are getting treated for the cancers they have or how they are getting treatment for any illness helps us understand trends that we're observing in utilization of healthcare over time. And that can be really useful. You know, it's useful to me as an oncologist because I understand and observing that patients are delayed in getting their cancer screenings and cancer treatment. Now, here we are in 2021, and I'm observing that patients who didn't get screened are presenting with later stage cancers. They frequently need treatment more urgently. They need more aggressive treatment. Their chances of being cured are diminished. Their chances of cancer mortality are higher. So it's helpful for me in understanding how we plan differently to try to support Americans in accessing their health care.
We're seeing regional spikes from the Delta variant in your home state as well of Texas and the return of mask mandates in some areas. Are we also seeing a replay of the delays in care or screenings or access to treatments like we did last year?
To some degree, but not exactly. I think that in 2021, as we're seeing in some areas, the COVID rates increase because of the increased prevalence of the Delta variant. We are seeing changes in healthcare utilization. So we are seeing a little bit of decreased screenings, but I think the world is different because all of our clinics now are implementing CDC guidelines. We're screening patients. We're wearing masks. So we know how to navigate this heightened risk environment now. So I think that those things are occurring to some extent, but not nearly to the extent that they were occurring when the pandemic ensued in 2020. And I think Americans know how to travel safely. We know how to go to the grocery store or get our groceries. We know how to go see the doctor. We know the doctor's office is a safe place to be. So many of those barriers that existed at the beginning of the pandemic are substantially diminished. There are still some barriers that exist. There is a whole backlog of patients that didn't have cancer screenings, that have their cancers undiagnosed. And so there are tremendous stressors to the system that has a certain capacity to deliver healthcare. And our ability to flex and increase that capacity to deliver healthcare is diminished during the pandemic because of social distancing and screening and all of the staffing challenges that we see today. So I think that we are seeing some limitations, but not to the extent that we saw them in 2020. I'm grateful for that.
Speaking of lessons learned from the pandemic, can you give us a sneak peek of the findings that you will share at ACCC's National Oncology Conference in November?
Absolutely. So obviously the pandemic has had many challenges on healthcare. We will discuss some of the trends that we've seen in how patients receive cancer care, which is alarming, and the impacts of that I think we'll feel for a decade. But I think that there are many things that we've learned about how to navigate a crisis like this that will serve us in the many years to come. So one of those is telemedicine. I think telemedicine has been the silver lining of the pandemic. In my own practice in Texas Oncology, we've done over 250,000 telemedicine visits. We were quick to adopt and universally adopted a really useful HIPAA-compliant private telemedicine platform that we continue to use to evaluate new patients and established patients. I think it's helped patients get the healthcare they need and are further evolving our virtual care delivery to really a virtual care clinic. And that serves a different set of needs. Not only does it continue to allow telemedicine to be a service that patients can receive, but it allows the ability to fill gaps in care that may exist today, whether it's the ability of clinics to have as needed staffing or to deal with some of the staffing shortages we have across the country.
Last question, Dr. Patt. What's the one thing that cancer care providers really need to know as they deliver care in this uncertain environment?
Well, I would say that it's been a hard year and a half for cancer specialists. Not only have we had to manage new changes with CDC guidelines and social distancing, and for many of us, that means we've told patients they have cancer alone and told them about their treatment and their prognosis alone and dealt with a lot of anxiety and depression. And the one thing I would say that we need to take with us is that cancer care is a team sport. I am not the holy grail of oncologic knowledge. I depend on a very talented advanced practice provider, a clinical nurse specialist, my care delivery team, my prior authorization specialist, my medical assistant, my social worker, and care delivery is a team sport. We need to make sure that we are working together with our teams to deliver the right care at the right time for the patients we serve.
Dr. Patt will deliver the keynote address at the upcoming 38th ACCC National Oncology Conference. Today's show was a preview of that speech, in which she'll dive deeper into the topic of the road to recovery for cancer care. That conference will take place virtually November 9th and 10th, and you won't want to miss this one. Find more information and a link to register in the show notes. Until next time, for the Cancer Buzz team, this is Summer Johnson.
Cancer Buzz is a resource of the Association of Community Cancer Centers.